Welcome back to the deep dive. Today we are wrestling with a question that really, it defines the modern patient experience. Can the new wave of large language models, the AIs you interact with daily, can they be trusted with your most sensitive health information? We're taking a hard look at the intersection of this cutting-edge tech and some genuinely high-stakes patient care.
And this isn't about general wellness advice, eat more kale. This deep dive focuses on a specific and very vulnerable population, patients undergoing treatment for head and neck cancer, or HNC. And the stakes are just immense because the treatments, radiation, chemotherapy, they frequently cause these catastrophic oral health challenges.
We are talking about serious life-altering side effects, things like severe xerostomia, which is just this debilitating dry mouth, and painful, sometimes bleeding mucositis, this inflammation of the mouth and throat.
Yeah, and then you have the long-term risks. Radiation-induced dental caries, osteoradionecrosis, which is, it's bone death in the jaw. These aren't just inconveniences. These complications, they absolutely demolish a patient's quality of life. They can stop them from eating or speaking comfortably.
And critically, that can interfere with their ability to actually stick with their life-saving cancer treatment.
Exactly. The clinical reality is grim. These issues are frequent, they're severe, and they require active, ongoing self-management from the patient. And here's why we're talking about AI. After their doctor, the internet is the second most used source of information for these patients.
So when they search, they're running into these LLMs more and more.
They are. And the quality of that guidance is, and this is not an exaggeration, it's critical to their recovery.
Right. So the mission for you today is to unpack a really rigorous comparative study that just came out this past December. Researchers put 8 of these common large language models through a detailed test. The goal was to see, are they reliable guides, or are they just advanced guesswork generators in this really complex medical field? We'll break down their reliability, their understandability, and crucially, their ability to provide actionable advice.
To set the stage, let's just look at how thorough this methodology was. The researchers needed a standardized, clinically relevant set of questions, and they used a really clever approach. They prompted 2 of the leading LLMs, ChatGPT and Gemini, to generate the 40 most frequently asked patient questions.
So they used the AI to basically write the exam.
Pretty much. And these questions covered 12 major categories, everything from managing that dry mouth to dental hygiene after radiation.
Okay, so who are the students taking this high-stakes exam? It was a full lineup of the industry heavy hitters, right?
It was. The study tested 8 specific models. You had ChatGPT GPT-4 Turbo from OpenAI, Gemini 2.5, Flesch from Google, Microsoft Copilot, also Perplexity, Chatsonic, Mistral, Meta AI's Llama 4, and DeepSeek R1.
And a key detail here, which you said we'll come back to, is that all the prompts were in German.
Yes, in German, and they used the base models, no extra clinical fine-tuning.
So we have the players, we have the questions. How do they grade the answers? Judging medical advice is more than just a pass or fail.
Oh, much more. They used a whole battery of validated tools. For reliability and quality, they used the DISCERN instruments, a score from 16 to 80. Higher is better. It tells you if the information is, safe and trustworthy.
Okay, so that's the clinical quality, but can a patient actually use the information?
And that's where the 2 most important metrics come in. From a tool called PEMAT. It gives you separate percentage scores for understandability and actionability.
Understandability and actionability. Break that down for us.
Sure. Understandability asks, can the patient easily get what this text is saying? And actionability asks, does this text give clear, specific steps the patient should take? Both are scored 0 to 100%, and the benchmark for good patient material is usually around 70%.
And what about just, the difficulty of the language itself?
Right, health literacy. For that, they use the Flesch Reading Ease Score, or FRES, adapted for German. Again, 0 to 100, but here you want to score above 70. That's like a 6th to 8th grade reading level, which is the gold standard. And finally, misinformation risk. That was on a 5-point scale, checked against official clinical guidelines.
Okay, let's unpack this. Starting with, I think, the biggest positive finding, the part that should make everyone breathe a little easier, safety. What did the study find about reliability and the risk that these things are just making stuff up?
This is genuinely good news, especially compared to studies from just a year or 2 ago.
Yeah.
Overall risk of misinformation was statistically insignificant across all the LLMs. The median score was a perfect 5.0 out of 5, meaning the risk was minimal. Yeah. It strongly suggests that these models are evolving fast and are becoming, thankfully, more reliable for basic cancer-related information. The risk of getting just flat-out wrong, damaging advice is low.
So the foundation is sound, but what about the overall quality? The context around those facts. That's where the full DISCERN score comes in.
Right. And the DISCERN scores put the LLMs in the good to fair range. The overall median was 54.0. Now, 54 it's acceptable. But this is life-altering medical advice. You really want to see those numbers much higher. However, two models did stand out. Perplexity and Chetsonic both hit a median score of 59.0.
Perplexity. Its name keeps coming up in these kinds of studies. What's different about it that makes it more reliable?
It seems to have a bit of an architectural advantage. It referred to way more citations in its answers. That's because Perplexity leans heavily on something called retrieval augmented generation, or a RAG. It's not just relying on its internal training data. It's actively searching and citing verifiable sources in real time. That's like an instant quality control check.
So it's showing its work. That makes sense. But this is where it gets really interesting for me. Because reliability is one thing, but it's meaningless if the patient can't do anything with the information. Let's pivot to those PEMAT scores. The study found this huge gap between understanding something and being able to act on it.
A profound clinical contradiction, yeah.
Yeah.
The LLMs were great at being understandable, but they completely failed at being directive. I mean, look at the numbers. Understandability was fantastic. The overall median score was 83.3%.
That's well above the 70% benchmark.
Way above. It means a patient can read the text and basically get the facts about their condition.
But then the other shoe drops, actionability.
Catastrophic. The median actionability score across all of them was only 40.0%. So the patient understands the definition of dry mouth, but the LLM gives almost no concrete specific, here's what you should do at 8 a.m. kind of guidance.
40%, that is.
Okay.
It's less than half the recommended benchmark. I'm just struck by that. You have high reliability, but this disastrous utility. If I'm a cancer patient trying to manage my pain, isn't reliable, but non-actionable information almost worse. It gives you this false confidence that you have the answer when all you have is a textbook definition.
That is the core dilemma this study brings to light. It delivers informative content, not actionable recommendations. And the researchers point to two main reasons for this. The first is liability constraints. The LLMs are designed to be cautious, to avoid giving explicit medical advice that could be harmful or, lead to a lawsuit.
But hold on, if they're avoiding action steps because of liability, isn't that a feature, not a bug? Maybe
Right.
they're succeeding where a more aggressive model could overstep and give dangerously specific advice without a doctor's context.
That's the debate, isn't it? The safety mechanism is sacrificing utility. And the second reason is just the nature of the training data. It's trained on explanatory, academic, risk-avoiding content, not on patient handouts from a doctor's office. They're built to explain the world, not necessarily to instruct you on how to act in it.
And this wasn't just a theoretical problem. This lack of actionability was felt most in the areas where patients need the most help.
Absolutely. When you look at the really practical categories, the actionability scores just hit rock bottom for things like side effects, dental care, tricks issues, nutrition. The median actionability score was 0. Zero. A score of 0 means the models provided no specific guidance for action steps whatsoever. They can tell you what osteoradionecrosis is, but they won't tell you how to prevent it with daily care.
Okay, so the content is safe, it's understandable, but it's not actionable. That's a huge problem. Let's move to the next hurdle, accessibility. Because even reliable info doesn't help if it's too hard to read. This is where we look at that Flesch Reading Ease Score, the FRES.
And the FRES reveals this big linguistic hurdle. Despite the high PEMAT understandability score, meaning the general concepts were clear, the actual language was super complex. The overall median FRES was 34.5.
34.5. Let's just put that in context for everyone. What does that score actually feel like to read?
It's far, far below the recommended score of 70, which is that middle school reading level. A score of 34.5 reads like a scientific journal or a university thesis. Now, you imagine trying to process that dense language when you've just gotten a cancer diagnosis and you're dealing with pain and anxiety.
That's a critical distinction, then, between PEMAT and PEMAS. PEMAT says, I understand the 4 steps you listed. FRES says, but those 4 steps were written in jargon-heavy 30-word sentences that I can't decipher. The technical accuracy is there, but the linguistic accessibility is just not.
Exactly. It shows the models still prioritize this sort of academic tone over genuine patient communication. For the average user, these answers are just too hard to engage with effectively, even if they're accurate.
And was this complexity the same across the board, or did some models do better?
There were differences, but the overall trend was difficult. Sonic was the worst, with a brutal median FRES of 16.6. Microsoft Copilot was next at 26.0. DeepSeek R1 was the easiest to read, but its score was still only 40.2, which is firmly in the difficult category.
It's like they're trying so hard to sound smart that they become useless to the person who actually needs the help. Let's do a quick performance review here. Across all these metrics, was there an overall champion? Or who needs to go back to school?
It was more like specialization, really. No single all-around winner. Perplexity and Sonic were the reliability champs with the highest DISCERN scores. In terms of sheer understandability, ChatGPT, Perplexity, Gemini, DeepSeek, and Mistral all did great. They all beat Microsoft Copilot.
And Microsoft Copilot seems to have struggled across these utility metrics, especially actionability.
It really did. Microsoft Copilot performed significantly worse than all the others in actionability. It had a median PEMAT actionability score of 0.
0. So in the most critical areas, that model offered zero guidance on what to do. That's just a profound failure of clinical utility, even if it's reliable.
It is, and it highlights the extreme caution built into some of these models. Interestingly, that might correlate with how wordy they were. Gemini generated the longest answers by far, about 672 words. Microsoft Copilot generated the shortest, just 116 words on average.
So what does this all mean for you, the listener? If you're turning to these tools for health information, what's the practical takeaway?
It means you have to be critically aware that performance varies wildly depending on the LLM you choose and what you ask. You can't assume consistency. The utility is highest for really specific routine questions like basic dental hygiene, but it just collapses when you ask about complex patient-specific issues like managing side effects.
So to summarize this whole deep dive for you, LLMs seem to have mostly solved the reliability problem. They offer reliable, low misinformation in this field, which is a huge step forward.
It is. However, they fail severely in two areas that are critical for patient education: providing actionable steps that a patient can actually follow, and using language that meets basic health literacy standards. They're impressive, informative resources, but they're absolutely not directive clinical resources.
Meaning they should supplement but never, ever replace a conversation with a human healthcare professional.
Precisely. The overall conclusion of the study is definitive. Despite the low risk of misinformation, these massive shortcomings in actionability, that 40% score in readability, that 34.5 FRES, they necessitate a really cautious, supervised integration of LLMs. They are unsuitable as a sole resource.
And that brings us to our final provocative thought for you to consider. If we agree the core problems are actionability and readability, those are fundamentally linguistic problems. The study noted this key limitation. The LLMs were trained mostly on English, but they were queried in German.
Right, a huge limitation. They are generalized language engines, not medical experts for a specific culture.
So here's the question. How might the clinical utility change if these models were fine-tuned not just for medicine, but specifically for the target language and the cultural context? Is the fix simply better localization? This suggests the real barrier to useful AI might not be the core medical knowledge, they seem to have that, but a hurdle of linguistic and cultural customization. Shifting them from just informative text generators to genuinely actionable clinical tools. Something to chew on as this all continues to evolve.
We've given you the knowledge. The next step is applying that critical thought to how you interact with these tools.
Thank you for joining us for the deep dive. We'll see you next time.